You've probably experienced it. You go to the doctor with a specific pain, a persistent symptom, or after an accident, and you hear the words, "We need to schedule a scan." And that's where the confusion begins. Am I going into that loud, spaceship-like tube? Or is it the fast machine that looks like a giant donut? Magnetic resonance imaging and computed tomography are the two most powerful tools in modern diagnostic imaging. Both allow us to look inside your body without the need for surgery. However, even though the final results might look similar, a series of black and white images of your organs, how they work, what they are used for, and the risks they involve are radically different. Choosing the wrong exam isn't just a waste of time and money, it could mean an inaccurate diagnosis. In this video, we're breaking down the 5 fundamental differences between MRI and CT so that next time you're referred for a scan, you'll know exactly what to expect and why it's the right choice for you. Let's get started. Number 1. The technology. This is the mother of all differences, the one that defines everything else. The way these machines interact with your body is completely distinct. Let's talk about the CT scan first. Think of a CT as a super X-ray. It uses ionizing radiation. The machine emits a beam of X-rays that passes through your body. A detector on the opposite side measures how much radiation is absorbed. The key is that the X-ray tube rotates rapidly around you, taking hundreds of views from every angle. Then, a high-powered computer takes all that data and reconstructs it into cross-sectional slices, almost like we're slicing a loaf of bread. Now, the MRI. There is no radiation here. It's pure physics and magnetism. MRI works by using a massive, ultra-powerful magnet, thousands of times stronger than the Earth's magnetic field, along with radio waves. How does it work? Your body is mostly made of water, and water contains hydrogen atoms. The MRI's giant magnet aligns all those hydrogen atoms in one direction. Then, the machine sends pulses of radio waves that push the atoms out of alignment. When the radio waves turn off, the atoms snap back into place, and as they do, they emit their own radio signal. The MRI detects these signals and uses them to create an incredibly detailed image. It is, quite literally, listening to the echo of your own atoms. Number 2. What we are seeing. Because of these different technologies, each machine is a specialist in seeing different things. CT is the king of dense tissues, especially bones. Because X-rays are absorbed very well by calcium, CT gives us unmatched clarity for viewing fractures, evaluating the spine, or detecting bone tumors. It's also excellent for viewing solid organs like the liver or lungs and for finding acute hemorrhages, as fresh blood shows up very clearly on a CT. MRI, on the other hand, is the master of soft tissues. Since it works by detecting water, it's incredibly sensitive at showing subtle differences in organs with high liquid or fat content. It is the gold standard for studying the brain, differentiating between gray and white matter, the spinal cord, joint ligaments and tendons, like a torn meniscus in the knee, and for evaluating tumors in very early stages. If you need to see the fine details of a muscle, nerve, or ligament, MRI is the answer. Number 3. Time and speed. In an emergency situation, time is life. And this is where CT wins by a landslide. A CT scanner is incredibly fast. A full scan of the chest, abdomen, and pelvis can take less than a minute of actual scanning time. This speed makes it ideal for ERs. If a patient arrives after a car accident or with a suspected stroke, a CT can provide answers in seconds to decide on immediate treatment. MRI is the complete opposite. It is a slow and patient process. A standard MRI study rarely takes less than 20 minutes and can easily extend to 45 minutes or an hour, depending on the complexity and the number of sequences required. Furthermore, during that entire time, the patient must remain completely still. Any movement, even a deep breath, can blur the image, requiring the sequence to be repeated and further prolonging the process. Number 4. Safety and contraindications. Each technology has its own safety considerations. With CT, the primary risk is ionizing radiation. Although modern machines are highly efficient and use minimal doses, radiation is cumulative. This means doctors avoid ordering unnecessary CTs, especially for children or pregnant women, due to the small theoretical long-term risk. Additionally, many CT studies use an iodinated contrast medium, which, while safe, can cause allergic reactions in some people or stress the kidneys if the patient has pre-existing renal issues. With MRI, the risk is not radiation but the magnetic field. As I mentioned, it is an incredibly powerful magnet. This means it is strictly forbidden to enter the MRI room with any metallic objects. Jewelry, credit cards, coins, and keys must stay outside. Most importantly, if you have metallic medical implants like older pacemakers, brain aneurysm clips, or metal shards in your eyes from a work accident, MRI can be dangerous. The magnet can move the implant or cause it to heat up. Fortunately, most modern implants are MRI compatible, but you must always inform the technologist before the study. Number 5. The patient experience. Finally, how you actually feel during the study. CT is generally a straightforward experience. The machine is a wide, open ring. You lie on the table, pass through the ring a few times, and that's it. There are no strange noises, you don't feel enclosed, and because it's so fast, most people tolerate it without any issues. MRI is a different challenge. Traditionally, an MRI is a long, narrow tunnel. For many people, this triggers claustrophobia. Although open or wide-bore MRI machines exist, they are still more confined than a CT. Then, there's the noise. While the machine is scanning, it emits loud thumping, buzzing, and knocking sounds that can be very annoying. Diagnostic centers usually provide earplugs or headphones with music, but the noise is still there. Add to this the need to stay motionless for 40 minutes, and you'll understand why many people feel a bit apprehensive about an MRI. In summary, which one is better? Neither. They are complementary. If there's an emergency, a suspected fracture, or an acute bone issue, the doctor will order a CT. It's fast and sees bone very well. If there's a chronic spine problem, a suspected early-stage tumor, or a ligament injury, the doctor will order an MRI. It has no radiation and sees soft tissues with amazing detail. We hope this guide has cleared things up for you. If you enjoyed this video and want to keep learning about health and medical technology from a professional perspective, don't forget to subscribe and give us a like. It really helps us grow. Do you have any experience with these machines? Tell us in the comments. Until the next scan.